Hi everyone, my name is Hong. Today I'm going to talk about a contemporary topic related to patient safety and a healthy workplace. Here's an overview for this presentation, which includes background, objectives, outline of the topic, and conclusion. Introduction of the topic. Mental health department can be seen as one of the most challenging areas in nursing practice, which require high attention of the nurse to maintain patient safety and a healthy workplace. The role of mental health care is to support and encourage people living with a mental disorder to strive for a real meaningful life. To make that meaningful life come true, building therapeutic relationship between a nurse and clients is one of the most important key parts in nursing practice. No matter if a disease is mental or physical, the nurse-client relationship is always being a strong bond that cannot be denied. Antonio 2017 stated that with the improvement of therapeutic relationship, the patient can be helped to get better and better by the sense of safety and the chance of recovery. The topic I would like to introduce is therapeutic relationships in the clients in mental health settings to describe what a nurse-client relationship entail and also how the nurse can build and develop these relationships in mental health area to create a healthy workplace and maintain patient safety. More than that, the ability to build therapeutic relationship will be reflected in an effective leadership. So what is the problem? The problem have chosen it to answer for the question how therapeutic relationship affects in a positive way to improve patient safety and create a mentally healthy workplace, and also aiming to determine that therapeutic relationship can be one of the most important elements of effective leadership. To make it more clear, the main purpose of the topic is to discuss and explore the concept of therapeutic relationship in mental health and what is involved in building this relationship. So why is this a problem? As I have introduced, mental health department is a sensitive area which need a high consideration and attention of the need to engage with clients. Dealing with a person who is having mental illness is not easy, unfortunately. Therefore, the way to interact and communicate between a nurse and clients is complicated. So an effective nurse-client relationship can contribute to maintaining patient safety, such as seeking client needs, observing client mental condition, performing MSc, and providing appropriate care. Relationship between the nurse and clients comprise effective communication, building trust, and cultural sensitivity, which resulted in the patient experiencing the hospital as the place of safety. So thus, the lack of trust in negative communication and a lack of safety will affect patient safety in reducing risks, preventing violence, and building a healthy workplace. For the reason, I strongly advocate that building and developing therapeutic relationship in mental health needs to be concerned as a contemporary topic in nursing practice. So why is it important to the patient safety and a healthy workplace? As we all know, maintaining and ensuring patient safety is an essential part of care provision, and safety is a multidimensional concept that incorporates interrelated factors such as physical and psychosocial safety. An effective nurse-client relationship plays an important role to manage patient safety risks and ensure the factors are considered when planning and delivering care, whether in the hospital or the community. It cannot be denied that the nurse directly provide care and also have a central role in meeting the client needs. More importantly, their observation and action can provide vital information and clarify how effective the treatment and how the patient is improving their mental state. Having a strong relationship with the client can help the nurse to deliver care more effectively and also help patient can lead a better life. Patient will be able to perceive values, attitudes, and a trading relationship as being more important than technical skill in the therapeutic relationship, so that patient can possibly receive individual attendance at the part of their treatment plan. Furthermore, having a good therapeutic relationship can help the nurse to create a healthy workplace in mental health department. A nurse with a strong relationship with the patient can easily educate with the patient to respect the community, hospital, or any other facility. A healthy workplace can be seen at the place where the health workers or the nurse can work together to promote and support good health. A strong bond of relationship is not only the way to interact with the patient, but also is the way to communicate with others health workers to create a healthy workplace. The therapeutic relationship can contribute to promoting workplace practice that encourage positive mental health and also can build the skill, capability, and knowledge of the worker to be resilient and thrive at work. More importantly, it also involves minimizing the risk from patient to the facility to maintaining a healthy workplace. Building a good relationship between a nurse and clients is what the healthcare system needs as always. Most of the client surveys have created and handed to clients to get some feedback from them of what they thought about the system and treatment plan, and also how to think about the nurse of delivering treatment and what they needs for the nurse and others health worker to improve in the futures. That's what the problem is being done so far, as what I have experienced during the placement in mental health department. Therapeutic relationship will be one of the most elements of effective leadership, which includes communication, both verbal and nonverbal, to inspire others to work together in achieving common goals such as maintain patient safety and a healthy workplace. Effective leadership can contribute to influence the other worker to make a good relationship with clients and staff, and also can educate in reducing a poor relationship to make a mentally healthy workplace. The background of the concept. The therapeutic relationship is one of the most significant tools in nursing practice, especially in mental health nursing, and also play an important role in increasing the effectiveness of nursing intervention. The concept of therapeutic relationship includes multiple terms such as the nurse-client relationship, the helping relationship, or the trusting relationship. This concept of therapeutic relationship need to be aware and also required to maintain and develop with the patient, which includes a lot of factors such as empathy and healthy work and healthy environment, active listening, consistency, teamwork, making a positive impression, and also supporting the development of therapeutic relationship. The lack of equality or variability and differences in experience and values are factors that limit the therapeutic relationship. Especially, patients might feel they have not received treatment as a normal people. They might lose themselves in the public area and also have a little relationship with the team. They also might think that's a nurse who is trying to avoid them from a condescending and intimidating attitude. As a new graduate nurse, we need to take a high responsibility to build a therapeutic relationship with the patient. To respond to the concept, we need to conduct into all of the attributes below, convey empathy and understanding, respecting individuality, being available on time, providing support, promoting equality, being genuine, respect, having self-awareness, maintaining clear boundary. The scope of practice. As we all know about the importance of therapeutic relationship in nursing practice, therapeutic relationship is one of the most significant RN standard practice. The RN need to sustain the relationship between professional and personal relationship, communicate well and respectful of the patient value, cultures, rights, dignity, and belief. More importantly, the RN should respect personal autonomy and legal capacity, ill coordination, regulation, supervision in the professional relationship to improve health outcome. The boundaries of therapeutic relationship are essential to protect both clients and nurse to maintain a functional of therapeutic relationship. The RN need to take responsibility for setting the boundary regardless of the client wish and request. Although maintaining a professional relationship in mental health nursing is essential, but professional role can conflict relationship development, particularly nurse self-disclosure and vulnerability promotes the understanding and relationship. but there could be a potential for boundary violation in using cell disclosure and vulnerability. Therefore, the RN needs to understand how they can be disclosure while maintaining professional boundary. Most of the researches were conducted through the electronic search such as Medline or Web of the Science. The keywords used were therapeutic relationship, patient safety, healthy workplace, nurse-patient interaction, and mental health. Research literature was exact between the year 2006 to 2019. The research and policy actually provide the sampling, data collection, analysis, and also argument about therapeutic relationship in mental health setting. The research delivers a deep understanding of the importance of therapeutic relationship with the clients in mental health nursing to maintain patient safety and a healthy workplace. All of the policy and research supported to the topic that I have chosen. More importantly, they also contributed to making this presentation even more clear in delivering information to the new graduate nurse. The main purpose of the presentation is to describe the importance of the nurse-client therapeutic relationship in mental health nursing and also how the nurse can build and develop the relationship in mental health. The information has been delivered by the presentation to help the new graduate nurse to understand this topic more clearly and effectively so that they will be able to learn and inform in their practice. The presentation play an important role to deliver information about the topic. In the presentation, the importance of therapeutic relationship have provided explains with a lot of research and evidence-based practice. The presentation provides smooth elements of therapeutic relationship which contribute to making effective listening leadership as a role model and quality improvement to other staff such as empathy and understanding, promoting equality, respect, and so on. Conclusion: therapeutic relationships are one of the most significant contemporary topics in nursing practice, which relate to patient safety and a healthy workplace. As a new graduate nurse, we need to learn how to build therapeutic relationship with the clients with the mental unit to seek mental condition to provide appropriate treatment plan. Importantly, building therapeutic relationship is also one of the most factors of effective leadership. To be a good leader, the nurse needs to improve all the elements of therapeutic relationship have mentioned in the presentation to lead healthy outcome, maintain patient safety, and create a healthy workplace. Thanks for listening. This is on the references.